Hello, ladies. Welcome back after a long pause. Do not forget that you can always take control of your health and well being. First things first, don't try to take care of your health on your own. Consult with a doctor for advice. In this post, we will talk about a health condition called chronic fatigue syndrome (CFS) or myalgic encephalomyelitis (ME). Chronic fatigue syndrome (CFS), also known as myalgic encephalomyelitis (ME), is a complex, long-term medical condition characterized by profound fatigue that is not improved with rest and is worsened by physical or mental activity. The fatigue is often accompanied by a wide range of symptoms that can significantly impair a person's ability to function personally, socially, and occupationally. Terminology and classification: chronic fatigue syndrome (CFS) and myalgic encephalomyelitis (ME) are often used interchangeably, though ME is considered more common in the UK, while CFS is more used in the US. Some experts use the combined term ME/CFS to encompass both. The World Health Organization (WHO) classifies ME/CFS as a neurological disorder under ICD-10G93. 3. Epidemiology, prevalence. Affects an estimated 17 to 24 million people globally. Gender, more common in women than men, about 2 to 4 times. Age, can occur at any age, but most commonly affects people between ages 20 and 50. Onset, often follows an infection, like Epstein-Barr virus, trauma, surgery, or significant stress. Causes and risk factors. The exact cause of ME/CFS is unknown, but several factors may contribute. A. Infections. Viral. Epstein-Barr virus (EBV), human herpes virus 6, cytomegalovirus, bacterial, mycoplasma, chlamydia pneumoniae. Often ME/CFS begins after a flu-like illness. B. Immune system abnormalities. Chronic immune activation and abnormal cytokine profiles are observed in some patients. See hormonal imbalances. Some patients exhibit abnormal cortisol levels, NHP, hypothalamic pituitary adrenal axis dysfunction. D. Genetic predisposition. Family clustering suggests a possible genetic component. E. Environmental and psychological stress. Major physical or emotional stressors may trigger the condition in predisposed individuals. Symptoms. Core symptoms. 1. Persistent fatigue, lasting more than 6 months, that is, not the result of ongoing exertion, not substantially relieved by rest, results in substantial reduction in activity levels. 1. Post-exertional malaise (PEM). Worsening of symptoms after physical or mental exertion, which can last days or weeks. 2. Unrefreshing sleep. Patients may sleep for long hours, but wake up feeling tired. Additional symptoms: cognitive dysfunction, brain fog, memory problems, slow processing, difficulty concentrating, orthostatic intolerance, dizziness, lightheadedness when standing, pain, muscle aches, joint pain, without swelling, headaches, sore throat and tender lymph nodes, especially early in the illness. Sensory sensitivities to light, sound, or temperature. Digestive issues. Irritable bowel syndrome (IBS) is common. Diagnosis: ME/CFS is a diagnosis of exclusion, meaning other causes of chronic fatigue must first be ruled out. Diagnostic criteria. For example, Institute of Medicine 2015, CDC. NICE. A patient must have fatigue lasting 6 months, post-exertional malaise, unrefreshing sleep, plus either cognitive impairment, orthostatic intolerance. Tests to rule out other conditions. Blood tests. CBC, thyroid function, liver or kidney panels, inflammatory markers, B12, etc. Sleep studies if sleep apnea is suspected. Mental health evaluation to exclude depression or anxiety as primary causes. though these may coexist with ME or CFS. Differential diagnosis. Conditions that can mimic or coexist with ME or CFS include hypothyroidism, depression or anxiety disorders, anemia, Lyme disease, multiple sclerosis, lupus, fibromyalgia. Management and treatment. There is no cure for ME or CFS, but a variety of strategies can help manage symptoms and improve quality of life. Lifestyle modifications, pacing, activity management to prevent PEM, energy conservation, prioritize tasks, rest frequently, avoid overexertion. Medications, pain relievers, for headaches or muscle or joint pain. Sleep aids, low-dose antidepressants, for example, amitriptyline may improve sleep. Antidepressants, anti-anxiety drugs, only if comorbid conditions are present. Stimulants or cognitive enhancers, sometimes used off-label to address brain fog. Non-pharmacological therapies, cognitive behavioral therapy (CBT), can help patients cope but is controversial if used as a primary treatment. Graded exercise therapy (GET), also controversial. Many patients report worsening of symptoms. Support groups and counseling, emotional and psychological support is crucial. Prognosis. Variable course. Some people recover or improve over time, while others remain severely affected for years. Full recovery is rare, 5 to 10%. Many experience fluctuating symptoms, with periods of improvement and relapse. Severe cases may be bed-bound or housebound. Complications. Social and occupational disability. Many patients are unable to work or attend school. Depression and isolation, resulting from chronic illness and misunderstanding by others. Financial burden, due to healthcare costs and loss of income. Conclusion. Chronic fatigue syndrome, or myalgic encephalomyelitis, is a debilitating condition that affects millions worldwide. Despite its severity and prevalence, it remains underrecognized. Early diagnosis, patient-centered management, and supportive care are essential to improving the quality of life for those affected. Continued research is vital to uncovering its cause and developing effective treatments. Always remember to ask for help and support when you're struggling with any health condition. If you need additional information, don't hesitate to contact us through the comment section. Kindly help us to comment, like and share to get this important information to the grassroots. See you on our next post.